Welcome everyone to the Human Health Organization. Today we are going to be debuting and launching our 3 brands we've been working very hard on. You're going to hear from a lot of speakers. You're going to hear from Seamus Blackley about the Vapebot, which, believe it or not, is a brand about robots.
I don't smoke, so to some extent all of this is abstract for me. Now I have friends who have died from smoking, but I don't smoke. So it's difficult for me to gauge whether or not a product is smoking well, if it feels good, if it's puffing properly, etc. And early on in the process of developing technologies for electronic cigarettes, it became clear to me that I was going to need to do something in order to make it so that I could smoke effectively. So I started toying around with the idea of building a device that could puff on electronic cigarettes while I worked on electronics and programmed and all the other crazy, possibly waste of time stuff that I do with new technology, and ended up building a little robot that is essentially an analog of a human lung. It actually replicates what's called the tidal volume, which is like tides in the ocean, and it means the amount of air that you breathe in and out taking a normal breath. And that tidal volume is what you use to actually smoke. Most people, it's not that much. It's about half of a 2-liter bottle of Coke is the maximum amount usually that you breathe in and out. And it's less if you're smaller and it's more if you're bigger. But I made a little robot that could breathe with this tidal volume. And then I had this very strange moment sitting in front of a keyboard in which I essentially taught the robot how to smoke, which is a really morally ambiguous thing to do because you feel like now humans have screwed up and addicted ourselves to nicotine, and now here's Seamus Blackley addicting an entire machine race of the future to smoking. But I did it anyway because what the hell. And ended up with a robot that we call the Vapebot.
You're going to hear from Dean Becker about Vaporcade and about the nature of electronic cigarettes and the intellectual property behind it.
About 4 years ago, I met a very, very charming gentleman in Hollywood because I had suddenly moved to Hollywood because I saw a convergence of technology, telecommunications, entertainment, and the audience changing. And I met this wonderful man named John Cameron, and he said to me, the only thing you should focus on is the 500,000 Americans a year who are dying from smoking tobacco. And I go, huh? I'm in tech, man. What are you talking about? He said, well, there's a technological revolution here. People have been lighting tobacco for hundreds and thousands of years to satisfy themselves, for a sense of community, to talk to each other, and there's a technology staring you in front of the face. And I had great difficulty trying to see into the future, and I think he made me envision the future that we were going to develop not only electronic cigarettes to serve the needs and hopefully save 500,000 American lives a year, but we would look at this technology as the next way to deliver other things besides nicotine. He said, well, why don't we take the cell phone and help it deliver drugs, help it interact with the human being, help it be part of our lifestyle, which it already is, but instead of us communicating with the cell phone, why don't we let the cell phone know what we're doing, who we are, where we're going, and who we want to be by tracking and measuring our use of what we're ingesting, what we're inhaling, what we're consuming, and what our activities are on a daily basis.
You're going to hear from Paul Rock, who's going to discuss some things about the association, the Asian American Convenience Store Association, and his wild take on where electronic cigarettes are going to go.
For my industry, it's convenience primarily. And our retail is predominantly dominated by Asian American retailers in convenience stores, corner stores, and ethnic grocery. Now, oddly enough, we represent just a small percentage of smoking. It's roughly about 87.6% of all smoking in the US. That doesn't make me a villain or a bad guy, but it does pose the question, how can we do things to change that? If I knew now, after meeting John and after forming this organization, that there was a way to, in fact, change, how were we going to do that? And so was created some of the best brands that you'll learn about and some of the best brands that you'll see come out of the Human Health Organization, such as American Value Cig, but more importantly, 1963 as a brand. The majority of electronic cigarette companies today are either owned, operated, or influenced directly by big tobacco. It didn't take them long to do. We thought maybe 15 to 20 years. It took them less than 5. And we know as a convenience store, because in a retail environment and for my membership, they come to me every day and they say, I'm being forced by, and I can't mention the names here today, but if I had to mention some names, I would mention names like R.J. Reynolds, like Lorillard, like Philip Morris Altria. I wouldn't mention those, but those are the big ones. And we get incentives to make sure that we're selling more tobacco, less electronic cigarettes, and that we take only the electronic cigarettes that they push. And they started to go from behind the counter to right in front of your face.
The man responsible, 50 years before any of us even knew what an electronic cigarette was, invented it in a town called Beaver while he was working in a yard at a scrap metal yard. His name is Herbert Gilbert. Don't forget it. Not only did he invent it 50 years ago, he's still alive, still on planet Earth, and I'm happy to report that he's here with us today. I can't imagine what it's like to have invented something 50 years ago and waited till now. But Herbert and I have become very good friends over the course of the past couple of years. If I could trouble you for a simple thing, which for a man who is going to be responsible for saving more lives than penicillin, if I could ask you to put your hands together for a man named Herbert Gilbert.
When I invented the electric cigarette, I didn't realize that I would be what I've become, the person that actually made the first one of these. It's very difficult to know that you have invented something that literally saves lives, and it's so difficult to get people to understand that there's a difference between smoking and e-cigs. We know everything that's in here, everything, and you can't beat it. You can make the batteries bigger, you can move what's inside around, you can add controls, but if you take the basic parts out, it isn't going to work. You have to know where what comes in here goes out there and what happens inside of it. And with a cigarette, you have no idea what's in there. You don't know anything about the tobacco, what the paper the tobacco is in. The real culprit, strangely enough, isn't tobacco. The real culprit, I figured out because I'm basically just a logical guy. The basic problem is combustion, fire. Show me the fire.